Okay, think about this for a second. Up to 85% of health research funding, something like what, $170 billion a year? Reportedly wasted.
It's a staggering number.
Yeah. And why? Well, often because the research, it just isn't relevant to the actual patients or the clinicians it's meant to serve. It's a huge issue.
A massive problem.
Yeah.
And it's not just the money, is it? It points to this fundamental disconnect. Research should be improving health, right?
Exactly.
But if it doesn't actually tackle what matters to people on the ground, well, it just falls short.
Which is where this idea we're looking at today comes in, research co-design. It's pitched as a way to maybe flip that script.
Right, bridging that gap we were just talking about.
Precisely. And that's what we want to get into in this deep dive. Figure out how involving the people the research is for can actually make it more useful, more effective, especially right at the beginning in those early planning stages.
Yeah.
It's about making research work better for your health. So let's start right there. What exactly is research co-design?
Well, at its core, it's about meaningfully involving the end users. So that means patients, clinicians, communities, the people actually affected.
Okay.
And the research we looked at really stresses doing this in the study planning phase.
Yeah.
So everything before you finalize the research question and the study design.
Before you lock things in.
Exactly.
Yeah.
That's seen as the critical moment to prevent all that waste we mentioned earlier.
So it's not just like a quick survey at the end or something. It sounds much deeper, much earlier.
Oh, definitely. The real shift, moving from doing research for people to doing it with them.
Right, with them. So what does that look like? What kind of activities are we talking about?
It actually varies quite a bit, but common things are focus groups, interviews, surveys, where researchers are really actively seeking input.
Okay.
Using those sessions to maybe prioritize what topics to research, or setting the whole agenda, or even just reviewing study plans and materials to make them clearer.
So like maybe a community group looking over a research proposal?
Exactly that. Or patients giving feedback on survey questions, saying this doesn't make sense, or you should ask it this way, making it user-friendly, relevant.
Okay. That sounds genuinely collaborative. And the sources mentioned different levels of involvement, too, like different roles.
Absolutely. It's
Yeah.
a spectrum. You could have people who are just advisors, maybe on a committee, offering guidance now and then, or they might be reviewers looking closely at plans, and then you get all the way to what's called co-production, where the end users might actually initiate the research or share control over it.
Wow, so quite a range.
Yeah, and the time commitment varies, too. Could be occasional meetings, could be really almost daily involvement sometimes. It's quite flexible, from advising to basically being a research partner.
Okay, so that's the how. Now, the big question, does it actually work?
Right.
What do the sources say about effectiveness? Is it living up to the promise?
Well, this is where it gets really interesting. Sort of a paradox, actually.
Oh.
Yeah, for all the enthusiasm, and it is widely used now, the sources make it clear that research co-design has very, very rarely been properly tested empirically.
Really?
Yeah, tested for its actual impact on, say, health outcomes or even cost effectiveness. It's a bit surprising, like everyone agrees it's a good idea, but there's a little hard proof yet that it definitively improves those key metrics.
So lots of positive buzz, but maybe not the rigorous data to back it up yet.
Precisely. What we do have, though, is quite a lot of qualitative evaluation.
Yeah.
And that tends to be overwhelmingly positive.
Okay, so what kinds of positives are people reporting qualitatively?
Things like patients feeling more empowered, research being more relevant to their needs, better recruitment into studies because people feel ownership, and researchers gaining new perspectives. So real benefits for the process and the people involved.
That definitely sounds good. Important stuff. But, when something sounds almost too good, you wonder, are there challenges, downsides? What complexities did the sources mention?
That's a fair question. And yes, there are definitely challenges. A big one is just defining it. Yeah, there's no single agreed upon term or definition for co-design. Makes it really hard to compare studies or know exactly what people did.
Right. Apples and oranges.
Exactly. And often, reports don't give enough detail about how the co-design was actually done.
Yeah.
Plus, yeah, there are practical issues. It can take more time, cost more money up front.
Resource intensive?
It can be. And sometimes there can be, tensions, different priorities between researchers and patients or clinicians, even worries about whether focusing too much on user preferences might compromise the scientific rigor.
So a balancing act is needed there. It really sounds like there's a need for clearer guidelines, better reporting.
Definitely. Clearer terms, better descriptions of what activities are happening.
And crucially, that robust evaluation you mentioned.
Absolutely critical. We need solid, long-term studies to actually measure the impact on health outcomes, on costs. Without that, we're kind of flying on potential and positive feelings, which are good, but maybe not enough given the investment.
Okay, so let's try and quickly sum this up. Research co-design, widely used, seems to bring real qualitative benefits. People feel better. Research feels more relevant.
Yeah, benefits for patients, researchers, the whole process.
But it's hampered by fuzzy definitions, inconsistent reporting, and this big one, a real lack of hard empirical evidence showing its long-term impact on health outcomes and costs.
That's the state of play, pretty much.
Yeah.
Huge potential, widely adopted, but waiting for that rigorous proof.
So here's something to think about, maybe. Given that potential and the money involved, just imagine how much more impact health research could have. If the voices of everyday people, patients, doctors, nurses, were genuinely part of it from the very start, and if we actually measured rigorously whether that made a difference in the real world.
It really makes you think, doesn't it?
Yeah.
What does that mean for how you view the medical research that, ultimately affects your life and your health?
Yeah.
How much difference could that real partnership make?